want you to rescue me.
Give Steve Wayte liberty or give him death. This is Tea Party Boot Camp Radio on 940 KYNO.
And welcome back to Tea Party Boot Camp Radio. On the line with me now is Bill Gleason, and Bill is the president of the World Trade Center Rescuers Foundation. You can find them at WTCrescuers.org. How are we doing this afternoon, Bill?
We're doing okay.
Now
There's a lot of memorials going on.
Yeah, now you're back in New York City currently. Are you at Ground Zero?
Now, I'm actually in Morristown, New Jersey. We just finished a memorial out here today, and I'm heading to Ground Zero in a little while for another memorial.
Well, why don't you tell the Tea Party Boot Camp listeners a little bit about your organization and what you saw that day and the weeks to follow?
Okay. I'm a FDNY EMS lieutenant. On September 11th, I was off duty, and when I saw the second plane on TV hitting the World Trade Center, because I had gone home, make arrangements for my kids before I went into work when I heard about the bombing, I first realized that, I'm dead. Let's go to work. The premise behind that is we knew that we were going to risk our lives, and because we did not know how extensive it was going to be, the potential for rescuers being killed was extremely high. Unfortunately, we did not realize at the time how truthful that statement was, because I now have lung disease from the World Trade Center. I've lost 49% use. We've lost 57 additional members of the department and over 800 total rescuers post 9/11, in addition to the over 400 rescuers that were lost on 9/11. I went down to the towers. I got there about 8 p.m. when we finally were able to bring the task forces out of Queens into the city. To give you an idea of the air down there, light actually pooled at the bottom of streetlights. It was clear. You could see, except for the smoke that was in areas, but sound didn't travel. You have a fire truck 300 feet away, you couldn't hear it pumping the water because it's just this low background hum that everyone was experiencing. And you were constantly coughing out dust and stuff that was in the air. I continued to go back to Ground Zero numerous times over the 9 months, and I wound up with appendicitis and thought nothing of it until we found out there was, numerous people in the fire department developed appendicitis at the same time. Still not putting two and two together. We continued to go back. It was about duty, honor, and, respect. I lost 141 friends that day. In the end, we only buried 86. We wound up with memorials for everyone else. So it's very important to a rescuer to bring fellow rescuers home. You trust them with your life. You trust that when the job is done, no matter how the outcome is, that you'll be returned to your family. And we, unfortunately, on 9/11, we weren't able to do that. I got sick in 2004. I went down to Health Services on my first visit there. They told me to put my retirement paperwork in. By the time I finally got retired, I began looking for information about the medical problems I was having, because I have hyperreactive airway disease and several other medical problems that developed from my toxic exposure. There was no information, literally. We began shaking the fire department, Mount Sinai, and the other resources within the city for what's going on with our health. And eventually we began to get some documents, but typical, one agency, one hospital would not share their information with others. So we created the World Trade Center Rescuers Foundation to create a centralized location where we could bring this information. And when someone is in trouble and needs help filing their workman's comp or having health issues that they can't explain, they can come to us. We can give them the information they need to be the best patient advocate they can for themselves. And sometimes we ourselves do the advocacy. We pick up the phone. We call legislators. We call physicians that we know. We call attorneys that we know to try to help them and these people out, because it's very complicated. Social Security issues, you have to deal with Congress. healthcare issues, anything to do with the Trade Center, you deal with New York State workers' compensation. Then you have the state compensation boards in every state that has to deal with New York State. It's extremely complicated. The information does not flow freely, and that's what we try to ensure that it does. They've gotten better, but there's still a long way to go. Health issues from the Trade Center, even though there's 40,000 known toxins we were exposed to, of which there are numerous carcinogens. They refuse to accept that the dust is causing us cancer, that our exposure down at ground zero is causing us cancer. And we're fighting right now to have Congress hopefully push CDC and NIOSH, who are administering the Zadroga healthcare law, to accept cancers as one of the healthcare issues. But every day we wind up paying the price. Just in the past 2 weeks, we've lost 2 additional members of the department, and there are several others who are at end stage of their cancer treatments and health treatments. It's an ongoing problem. It's in all 50 states. It's actually we know that it's in France, and we know that there's patients in Canada and in Mexico that have had problems with their exposures at ground zeros. Because I hope your listeners understand that rescuers came from all 50 states. Everyone came, police, fire, the trades, to help us. They also came from 27 other countries, and they went home. Now they're getting sick. They need help. They need information. And we're one of the resources that are out there for it. We're an independent voice. We've been doing this now for over 6 years, totally out of our own pockets and with very small donations that have come to us so far. We've finally received, after a long time, our 501c3 from the IRS. So we are a 501c not-for-profit public charity. None of my board members or anyone associated with the foundation takes a dime for ourselves. This is about honor. It's just a continuation of what we were doing down there. We supervise these people that are getting sick. We ask them to come and help, and sometimes we even sent them down there. So how could we take any money for this? It would be blood money. And this has been going on now since, 2002 when the first people began to get sick. And it's only gotten worse. There are now 34,000 rescuers who are disabled, according to New York State workers' compensation. And Mount Sinai did a study. They said 76% of the rescuers there in the first 3 days are sick. 64% as long as the fires were burning, which was all the way up until Christmas. And then it drops to 14% after Christmas when the fires were out.
Mm-hmm. Now, Bill, and the dogs, most of the rescue dogs had died by 2005, hadn't they, Bill?
Yes, that's what we've been told, is that the rescue dogs passed away, most of them from cancers.
Mm-hmm. So does your group actually financially support people and victims that are looking for medical services, or are you more of a facilitator to help them get in through this bureaucracy that we call government?
Well, we're a facilitator. We found that, individual support, there's other groups out there. We prefer, if the money comes in, to get it out where it does the most good. Instead of helping one family, if I can help 700 families or more. I mean, we've had hits on our website of over 10,000 hits in a day. We've numerous people coming to us asking for help, not only for themselves, but for their friends and stuff. Mm-hmm. So if I can use that dollar to get the word out, get the proper information out to more people, it's better. It's a dollar better spent than trying to help individually, because there's enough organizations out there to help individuals. We like having that independence. We've been paying for this out of our own pockets, and each one of my board members probably spends in excess of $3,000 a year, which on limited incomes is a lot of money. Mm-hmm. To keep this thing going. Our website costs money. Publishing the flyers that we do, even though we put them in black and white and try to be as economic as we can, and try to do as much green by having it available online, it still costs money.
Sure.
And I'd rather, spend the money helping more people, because you have a lot of people that are actually afraid to come forward and say, I have this medical problem to agencies or even to the city because they're afraid that it'll affect them at work. They'll be told you have to retire. And my income is way less than half of what I used to make when I was employed.
Sure. Well, and that's what's so frustrating with the bureaucracy, Bill. I know that there's been millions and millions of dollars set aside and put aside for the care of the first responders. The problem is most of those dollars are spent in their bureaucracy, and they never get to where they are going to help somebody get through the condition that they're facing.
Well, actually, the Zadroga healthcare law established for the medical monitoring and applied some money for healthcare, but the lion's share of the healthcare for us is still based in workers' compensation.
Mm-hmm.
I don't know how it is in most states, but in New York, it's a nightmare because you literally have public health care, which has to be approved by workers' comp. They send it to a nurse or to a doctor to review, to authorize a doctor to give you treatment. But meanwhile, almost all of us have health insurance, either Medicare, GHI, or some of those type programs, and we can't use it because it's a workers' compensation injury. And then on the other side of the coin, they're not acknowledging cancer. So someone who's health cancer treatments, which cost tens of thousands of dollars, that should be covered by workers' comp, is being forced out of the patient's pocket.
All right. Well, Bill, that's all the time I've got for today. It's going to be a very, very emotional weekend for you. My prayers are with you, and I'm really out of words to even say it. It's quite an emotional 10th anniversary of 9/11, and I'm sure tomorrow there's going to be a lot of tears shed. Bill, thank you for the time that you gave us today. Bill's website is WTCRescuers.org. That was Bill Gleason. He's former lieutenant with FDNY EMS, retired, and he was a World Trade Center first responder. You're listening to Tea Party Boot Camp Radio on 940 KYNO.
It takes every kind of people.